Depression is a disorder of the brain's and body's ability to biologically create and balance a normal range of thoughts, emotions, and energy. Scientifically, depression can be defined as a chemical disorder which alters the function of normal brain behavior. It affects 1 in 5 and is caused by unusual levels of chemicals such as neurotransmitters, beta-endorphin, serotonin, and dopamine. It is commonly believed that depression arises from genetic makeup, but also through the influences of the external environment. Other explanations could be extreme trauma experienced during childhood. Depression fluctuates in severity, and 4 major types can be identified. The least severe type of depression is often thought of as the normal depressed mood. This is considered healthy because it is a natural reaction to a disturbing event, and even more so because the sufferer will recover. The second type deals with adjustment disorders. This stage is considered more serious because those suffering with such a depression are not as likely to occur. Mild depression is the next level of depression. The symptoms of this stage include chronic depressed moods and low self-esteem. It is most often treated through therapy and/or medication. Major depression is the last and most severe type and is characterized by feelings of despair and utter hopelessness. Not only do sufferers of major depression have low self-esteem, but they also lose interest in life. For many, major depression includes the inability to get out of bed or even eat. At this stage, suicide is often contemplated. There are many changes in a depressed brain. Most often, there is absolute or relative depletion of neurotransmitters like serotonin. There is also diminished activity in the left prefrontal cortex and increased activity in the right prefrontal cortex, areas of the brain involved in processing emotion. Severely depressed people show diminished activity in the interior regions of the cerebral hemispheres, especially the left side. Low activity of norepinephrine and serotonin also may serve as symptoms. Abnormal release of cortisol, a hormone released by the adrenal gland during stress, or too much melatonin are changes that can also be seen. When treated, over 80% of those suffering from depression are successfully aided. There are numerous methods of treatment for this illness. The 2 most common treatments are antidepressant medications and counseling. Currently, there are numerous different antidepressants on the market, and most depressed people can find a medication that works considerably well. In fact, it is estimated that antidepressants can raise one's mood anywhere from 60 to 80% when used properly. Although antidepressants have proven effective, many doctors prescribe counseling or psychotherapy as an additional method of treatment. The basic principle behind such treatments stems from Freudian psychoanalysis. The idea is to first help the individual identify his or her issues and then to help them cope with the accompanying emotions. Other alternative methods that have become acceptable treatments for depression includes herbal medicines and supplements. In addition to the numerous treatments for depression, many doctors have found exercising has positive effects on one's body and mind. In support of the psychological benefits, it is argued that exercising increases one's self-confidence as well as providing a feeling of accomplishment and mastery, which in turn may raise an individual's overall outlook. It is argued that exercise helps improve one's mood by providing a more grounded perspective on life, by providing an opportunity for more interaction, and by reducing immune system chemicals that can worsen depression. Exercise also helps by increasing body temperature, which may have calming effects, providing for gaining confidence, taking your mind off worries by serving as a distraction, and helping one cope in a healthy way by doing something positive to manage anxiety or depression. Finally, exercise can cause a release of neurotransmitters beta-endorphins and serotonin. Beta-endorphins are part of the mood-regulating chemicals that reduces pain and can even induce euphoria. In fact, it is even now believed that the increase in beta-endorphins when exercising is the true cause of the euphoric state known as runner's high. Serotonin has been successfully linked to mood and in particular is responsible for the availability of neurotransmitters at receptor sites. For the brain to maintain a stabilized mood, it must have balanced levels of serotonin. Most doctors have relied on drugs such as tricyclic antidepressants and specific serotonin reuptake inhibitors, or SSRIs, to monitor the levels of serotonin in the brain. However, as more studies are being performed on exercise and depression, scientists are hypothesizing that exercise may raise serotonin levels enough so as to help those suffering from depression. There is more conclusive evidence that has been gathered to explain the effect of exercise on the body. Of the possible explanations of how exercise affects physical activities is found in the monoamine hypothesis, which is based on the theory that exercise increases the brain's synaptic transmission. In other words, the monoamines in the brain, such as serotonin and dopamine, have an improved transmission rate when exercising occurs. This is beneficial for those depressed because such chemicals in the brain directly affect one's mood. The endorphin hypothesis is but another theory as to how exercise affects the body. Extended exercise has been proven to increase the secretion of endorphins, which improve mood and decrease depression. The distraction hypothesis is a theory based on the idea that diversion from painful stimuli leads to an improved state after exercising. Distractions from the stress of daily life through exercise cause a beneficial decline in anxiety and depression. The third theory is the self-efficacy theory, which is founded on the idea that one must first have the confidence that he or she can perform a certain behavior. It is thought that when a depressed individual simply becomes motivated enough to perform the act of exercise, his or her self-esteem is raised, and in turn, depression lessens. Lastly is the mastery hypothesis. This suggests that if one is able to use exercise as a means to gain control and a feeling of mastery, his suffering from depression may slightly decrease. Exercise has been proven to have psychological benefits on clinically depressed individuals. Now that it has been proven that exercise is a plausible treatment for depression, many wonder which types of exercise are the best. The word exercise may make you think of running laps around the gym, but a wide range of activities that boost activity level can help you feel better. Running, lifting weights, playing basketball, and other aerobic activities that get your heart pumping can help. But also, gardening, washing your car, or walking around the block can help as well. Anything that gets you off the couch and moving is an exercise that can help improve your mood. Many doctors recommend doing 30 minutes or more of exercise a day for 3 to 5 times a week to significantly improve depression symptoms. Exercise helps prevent and improve a number of health problems, including high blood pressure, diabetes, and arthritis. Research on anxiety, depression, and exercise shows that the psychological and physical benefits of exercise can also help reduce anxiety and improve mood. It is important to note that depression is not specific to the human condition. Like humans, dogs do occasionally suffer from depression. They get mopey, lethargic, stop eating, and drink only a minimal amount of water. They stop wanting to play, and they even lose drastic amounts of weight. Depression can be caused by grief, change of scenery, or sometimes a chemical imbalance, which needs medication to correct. Even the weather or the master's health can adversely affect the normal mood of a happy dog.
Research has repeatedly shown that, along with medication and therapy, exercise is highly effective in treating and preventing depression. Those who exercise several times per week have significantly lower rates of depression. Exercise releases some of the same chemicals that are produced by drugs that create a sense of euphoria, such as heroin, and studies have shown that sense of happiness to last after the exercise.